You had bariatric surgery. You worked incredibly hard. You lost 50, 60, maybe 100 pounds. Life was really becoming different, better. Then the scale stopped, or maybe it started going back up. Now you're looking at Ozempic, Wegovy, or Zepbound and thinking, did I fail? The answer, no. Absolutely not. Because obesity isn't a character flaw or a lack of willpower. It's a chronic disease. And sometimes chronic diseases need more than one treatment. But here's the important question. When is the right time to add those kinds of medications after bariatric surgery? Hi, I'm Grace, and I'm a physician assistant who has worked with bariatric patients for 20 years. This video is general education only and is not personalized medical advice. Today, we're going to talk about whether GLP-1s can help after bariatric surgery, who might benefit, and when it makes sense to start these medications. Bariatric surgery is one of the most effective tools we have for treating the disease of obesity, but it is still a tool. It does not erase the biology of obesity, and this is where patients sometimes get blindsided. They may lose weight beautifully for the first 12 to 18 months, and then the scale starts creeping up, or food noise starts to get louder, and the patient thinks, did I mess this up? Did my surgery fail? Is this my fault? Sometimes there are behavioral factors, absolutely, but biology plays a role too, because sometimes weight regain after surgery has more to do with biology than willpower, and that's exactly where GLP-1 medications enter the conversation, but not always when people think they should. GLP-1 medications mimic or enhance signals that help regulate appetite, fullness, glucose, and weight. They can help patients feel full sooner, reduce cravings, decrease food noise, and for patients with diabetes or prediabetes, they can also help with blood sugar. After bariatric surgery, they can support the results of surgery if weight loss is less than expected or if regain happens. If there's an anatomic problem after surgery, medication may not be the whole answer. So GLP-1s are powerful, but they work best as part of a comprehensive medical plan. But here's the question a lot of people ask: when can I start on a GLP-1 after my bariatric surgery? And the answer is not the same for everyone. Traditionally, many providers waited until a patient had already regained a significant amount of weight. So the pattern was surgery, weight loss, regain, then medication. But some obesity medicine experts are asking whether that wait is too long. Today, many bariatric specialists will consider adding GLP-1s when weight loss has plateaued, weight loss is less than expected given a reasonable time period, diabetes, prediabetes, blood pressure, sleep apnea, or fatty liver is returning or worsening, weight regain is starting, hunger, food noise, or cravings are returning strongly despite a high compliance rate with protein intake, bariatric follow-ups, physical activity, and supplement intake. But before recommending medication, a good bariatric team steps back and asks one important question: why is the weight changing? Because weight loss medication should address the right problem. So before prescribing it, your bariatric team may consider the following issues: stretched stomach or gastric outlet pouch dilation, inadequate protein or fluid intake, grazing or taking in liquid calories, untreated sleep apnea, a decrease in physical activity, a life event or mental health trigger that is causing emotional eating, and other issues. Medication can help, but it should not replace a thorough evaluation beforehand. And this is where I want to say something very clearly. If weight regain happens, hiding from your bariatric team is one of the worst things you can do. And unfortunately, many bariatric patients do this out of fear. Please don't disappear. Let me dispel the myth. A knowledgeable bariatric team is not going to shame and blame you. They understand clearly that obesity is a chronic disease and oftentimes requires more than one strategy to help patients be successful with their weight loss on a long-term basis. So if the issues in this video resonate with you, please reach out to your bariatric team soon. They can help you now before the weight gain feels overwhelming. This is another important point. The goal is not just to make the number on the scale smaller. The goal is to treat obesity-related complications and improve your overall metabolic health, and of course, help you live a healthier life. That's why I always encourage long-term bariatric follow-up, not because you failed, but because obesity care is long-term care. If you're watching this video because you didn't lose the weight you thought you would, or you started regaining weight after bariatric surgery, I hope you hear one thing today: you did not fail. You may simply need another tool. Obesity treatment doesn't end after surgery. Sometimes it simply changes. Go back to your bariatric team. Ask for help. Ask whether medication is appropriate for you. And remember, surgery, nutrition, physical activity, behavioral support, and medication can all be part of treating the same chronic condition, obesity. If you want more information about how to safely survive after bariatric surgery, check out this video. And if you'd like more information about bariatric surgery and medical weight loss education, subscribe, because that's exactly what we talk about on this channel. I'm a physician assistant, but I'm not your PA. Any treatment decisions should always be made by your healthcare team. Thanks for watching, and I'll see you in the next video.